By definition, breastfeeding is a woman's ability to naturally provide her young infant with the nutrients they need for healthy growth and development. At the maternity department of the Port of Spain General Hospital, staff at the lactation management unit say they are making it their duty to ensure that expecting mothers are well informed about breastfeeding. Nursing assistant and lactation trainer Sharon George shared the benefits.
The first milk which the mommy has is called colostrum, and that has myriads of benefits. Number one, it helps to reduce the baby's chances of getting infections. So we try our best to get our babies early on board with that. Other thing, remember, you're going to save money, right? Because it's costly to buy milk now, and you already have milk there, so there's no need for mommy to have to go and study to purchase milk, because you could have things like babies reacting and so, right? And for the mommy, it helps to slim mommy down while the baby is attached. Yes, the mommy tends to lose weight. It helps the baby with the IQ. Breastfeeding children are very much more intelligent. It helps with the IQ because it builds on the brain cells. Also for the baby, remember, it's very nourishing. It has everything in it. It's a compact deal. It has all vitamins, proteins, everything that the baby needs. And the best part of it is that as the baby grows, the milk changes to suit their age.
Even with the advantages of breastfeeding coordinator and lactation trainer Giselle Turner says data shows the number of women who actually breastfeed their babies in this country is low.
Last statistic that came would have been in the early 2000s, and our rates of exclusive breastfeeding is low. It is below 50%. And that is something that we have to work on through education and otherwise, so that persons can understand the importance of breastfeeding.
Ms. George says one excuse she hears from mothers who do not breastfeed their babies is that they have to return to work. She explains that it should not prevent a new mom from expressing and storing milk.
Most mothers are going to be home for like 3 months. So you're not going to wait till like 2 months and 3 weeks into breastfeeding to start to store. So when you reach home like comfortably about 2 weeks, mommy starts, as the baby finish feeding, it is likely for her to start expressing at this time. Because the more the baby sucks is the more milk she has. So it goes the same way with expressing. The more she expresses, the more milk she will have, and she can start to store.
Okay. Question, is there a way that mommies can ensure that they're producing enough milk?
Right, as I said, the more a baby sucks, is the more milk will produce. Now, milk is already there from 5 months during the pregnancy, right? But it's the early attachment of the baby. Once that is fine, milk production is there.
But how exactly should a mother position herself to breastfeed her baby?
We use tummy to mommy so that mommies will remember. This hand tends to get in the way when mommy's trying to breastfeed. So they might have the baby like this and the hand swinging. So we tell them, tummy to mommy, and this hand we try to secure it here. The head is supported here at the back and the buttocks with this hand. This hand we use now to position the baby's mouth to the breast, and that the baby will not go onto the nipple where mommy thinks the milk is, but onto the areola, the dark part surrounding the nipple. And once you get that position in here, you stimulate baby, the baby tends to bring the head back, and then comes forward, and so the mouth is open wide now and gets a good latch and attachment to the breast.
And while some mothers find it difficult expressing milk for their child, Ms. Turner had this insight.
When the baby starts suckling the breast, a message goes to the brain saying produce milk. So a normal baby, normal breastfeeding baby that is, should go to the breast 8 to 12 times in a day. But mummies usually find that is a bit much, so they tend to want to supplement, and in supplementing, that requirement goes down. So conversely, if you're only putting the baby to the breast 6 times, you will only have milk for 6 feeds.
She shared the dangers of other people breastfeeding your baby.
In the ancient times, historical times, there was something called wet nursing, right? But with the advent of all the other diseases that are around now, it means that that person will have to be tested to ensure that that can take place.
The Northwest Regional Health Authority has been working on new ways to ensure that their institution attain the international standard for the baby-friendly hospital initiative.
The premise of it is for maternity hospitals to put and have an environment that is conducive for breastfeeding, because breastfeeding is linked with the emotional status of the mother. So trying to have that comfortable environment with persons that can support breastfeeding, which would include the lactation management unit and the members of staff that we train, so that we would be able to have that environment so that mummies can focus on the wonderful art of breastfeeding.
Just recently, the NWRHA launched its breastfeeding calendar, mascot and passport, an initiative Health Minister Terence Dial Singh challenged other regional authorities to adopt. Marie Hall, C News.